And what we have here is a medical device, an integrated medical device system. It's a platform that tests your autonomic nervous system, vascular function, as well as provides risk assessments for cardiovascular disease, as well as metabolic disease, such as diabetes. And the point of the device, the features of the device really allow a clinician to differentiate the cause of patient symptoms, patients with metabolic disorders, diabetics, which is primarily the disease state that we're focused against. We're focused against some other ones, but a diabetic will present to a doctor with leg pain. And what our device does by checking and testing the nervous system as well as vascular function allows the doctor to differentiate whether that pain is related to a vascular problem or a neuropathic problem. So that's what that means, differentiating the cause of patient symptoms. Our device has markers that provide early detection of metabolic diseases, type 2 diabetes, for example, as well as vascular disease. So we have some predictive markers. Also, the device allows the detection of complications related to the autonomic nervous system and vascular function. Bear with me for a second, everyone. Okay. Okay. And finally, the device allows treatment management of type 2 diabetes. And we have some scoring markers as well as some risk markers that you'll find important for the doctor to have in order to treat his patients. So the system involves some hardware pieces, and it also involves the use of a computer. And basically, these are the hardware pieces that we have with the system. It includes a console box, blood pressure cuffs, a pulse oximeter, a manometer, and the different cabling that pertains to the system. So it's basically integrating 4 medical technologies into one platform. What you don't see here is a computer. So a computer would connect to the system here. As I mentioned, the technologies and the diagnostics. So the 4 technologies that we have include our Sweat-C. So the device has electrode pads that are placed on a patient's foot. Those electrode pads perform a technique called galvanic skin response. Those electrode pads provide a diagnosis for small fiber neuropathy. Okay, if you think about diabetics, as I mentioned already, one of the first complications that diabetics face is neuropathy, foot neuropathy, and it begins with the small nerve fiber, and that's what we're testing in the sweat with Sweat-C, the electrodes. The device also has the technology ESBC. It's a technology that's incorporated into the foot electrodes, and so the electrodes send an electric current, and we're able to perform analysis, bioimpedance analysis, to provide us some markers of body composition. So similar to what you'll find when you go to a gym or a health spa, they have these body composition devices that now measure fat mass. And that's basically the same technology that we employ with the electrodes on the feet. The second part of what the electrodes are doing is performing a measurement of body composition. The LV-oxy is our pulse oximeter, and our pulse oximeter performs what's called pulse wave analysis, or more technically, photoplethysmography. So what that provides us are diagnostic markers for endothelial dysfunction. It also provides markers of fitness level, cardiac autonomic dysfunction, cardiac autonomic neuropathy. So you can see the theme here that we're basically identifying is neuropathy. One of the big themes is nerve damage, neuropathy, related to metabolic disease. So you can see that. The other thing that you can see is the vascular. Okay, and so obviously the first component is endothelial function, which is one of the most significant regulatory mechanisms of the body. And then finally, the technology that we have is the ABI. And so the ABI includes the blood pressure cuffs, and they're Bluetooth wireless blood pressure cuffs that perform the ankle brachial volume measurement, as well as volume plethysmography. And essentially what we're deriving, or what we're diagnosing with the blood pressure cuffs and the analysis of the blood pressure, is peripheral artery disease, PAD, which you probably have heard of. It's a very, very significant complication, vascular complication that's becoming standard of care to test for. Peripheral artery disease or peripheral vascular disease, as well as blood pressure analysis. We perform significant analysis of the blood pressure for hypertension, central systolic blood pressure. We'll get to the markers. We'll get to the software. So you'll see how all of this plays out as I continue through the background of what the medical device is. So you've seen the medical device, the hardware pieces, okay? And basically, what the device is doing in 7 minutes, it's a non-invasive test. It's a 7-minute test. Now, it's going to take maybe a few minutes more to set up the patient, input the data into the software. But essentially, the test, once started to completion, is around 7 minutes. And you see the patient is lying down in the supine position through the majority of the test. What does the patient have? The patient has a blood pressure cuff on the arm, 2 on the ankles, and of course these are wireless Bluetooth cuffs, as I alluded to. The pulse oximeter on the index finger, and the electrodes on the feet. So you can see what's connected here. Blood pressure, arm, ankles, electrodes on the feet, right and left foot, and the finger and a pulse oximeter. Performing one, photoplethysmography, as I alluded to, which is pulse wave analysis to provide a lot of diagnostic information. Ankle brachial with the blood pressure. And then what I talked about, the galvanic skin response and bioimpedance for fat mass, as well as small fiber neuropathy. The folks that should be tested are patients that show symptoms either suggesting autonomic neuropathy or PAD. So this is the medical necessity for the test. And according to the American Diabetes Association, this type of testing is recommended for type 2 diabetics at the time of diagnosis, and 5 years after diagnosis in individuals with type 1. And from the American Heart Association, ABI testing, okay, is recommended for all patients over 50 who have diabetes, hypertension, high LDL cholesterol, smokers, and everyone over 70. So you can see it's a pretty big population of folks that should be tested. So to sort of broaden out what we're diagnosing with our device, these are the different diagnoses for the system. ANS dysfunction, and you see the symptoms below. Baroreceptor dysfunction. Cardiac autonomic neuropathy, and the symptoms below. POTS, which stands for posterior orthostatic tachycardia syndrome. Okay, and you see the symptoms. Sinus node dysfunction, endothelial dysfunction, hypertension or high blood pressure, peripheral artery disease, as well as small fiber neuropathy. So those are the diagnostics that are provided with the system, that we are testing for with the system. Now, I'm going to get into the markers in much greater detail as we go through the software, but I just wanted to present this the main features of our testing, which include a cardiometabolic score, an overall score, as well as the different areas that we test for: autonomic function, vascular function, and lifestyle. And so this CMR score, and it's, of course, it's an off-label score, but in studies that we've performed show that our marker here, which is an algorithm that's derived from the different modalities that we test, is basically a marker, a predictive marker for diabetes, and it's non-invasive. Now, we are not replacing any of the current or suggesting to replace any of the current lab tests to detect diabetes, such as the OGTT or the fasting glucose or the A1C. We're merely providing an adjunctive marker to help the doctor better understand what's going on with the patients, particularly those that haven't been tested for diabetes yet, because what we've done is we've provided some predictive markers, which I'll get to a little later. So let me just point out a few benefits. So the product is non-invasive. Okay, the software is very intuitive. It's easy to use. The measurements are all simultaneous. The report is clear. You'll see that. The results are accurate based on our patented markers, as well as validated by a variety of clinical studies. And the system is simple for the technician. Since it's wireless, it makes it much easier for the technician to perform the tests. So why the product? Again, we're looking at chronic metabolic diseases. We're focusing on diabetes. It's a very significant disease state in the United States, but internationally as well. And currently, there's around 30 million Americans that have been diagnosed with diabetes. Okay, so that's roughly 10% of the population has been diagnosed with diabetes. 86 million are pre-diabetic. Okay, so that's a big chunk of the population, and it's growing. The folks who are at risk, the people who have diabetes, are at higher risk of other health complications. So I've mentioned the foot neuropathy. Okay, so that's certainly a complication, and that can lead to an amputation. Vascular complications, arteriosclerosis, coronary artery disease, stroke. These are complications related to diabetes. Eye complications, retinopathy, which can lead to blindness, kidney complications, nephropathy, okay? And we test for these conditions. So you can see it's a pretty big population. It's a significant cost to the healthcare system. And so what we've done is we've tried providing an earlier detection to help ameliorate some of these expenses. So diabetes, we know it's a 10-year process. So diabetes begins 10 years before the actual lab results are presented. So here is when lab tests are diagnosing the disease. But prior to the actual fasting glucose, OGTT, all the different lab tests to diagnose diabetes, there's damage that's occurring 10 years previous. Damage of the autonomic nervous system, the nerves, damage of the arteries, okay? And this is what we're capturing with our system, okay? Early detection, predictive markers, as well as markers of complications, okay? And those complications, as you know, are autonomic neuropathy, small fiber neuropathy, and then vascular problems, endothelial dysfunction, PAD, hypertension, so forth and so on. So Diabetes is a process that begins 10 years before diagnosis. We're capturing damage of the nerves and the arteries, okay? And we're also capturing damage that's a result of the disease state. Insulin resistance, we're able to capture that. We have a marker for insulin resistance. Insulin resistance is predictive, okay? Insulin resistance predicts that an individual, that a patient will go into type 2 diabetes, okay? It's also a very high predictor of cardiovascular disease, as you can see here from this chart. So if an individual has insulin resistance, they're at greater risk to have cardiovascular disease than a smoker. So not only does it predict diabetes, but it also predicts cardiovascular disease. And it's also linked to obesity. So insulin resistance is very significant. We have a marker non-invasively that shows insulin, that we can see insulin resistance. So we have a marker for insulin resistance, which is very accurate. Again, the ANS and endothelial functions are main regulatory systems. The autonomic nervous system is basically a network of nerves, okay, that's split into two branches, the sympathetic and parasympathetic. The sympathetic is basically the accelerator, okay, so it's what stimulates nerve activity, and the parasympathetic is what inhibits the nerve activity, and it controls all of the involuntary functions of the body, okay? So if there's damage here, okay, or there's issues with the autonomic nervous system, it's going to lead to disease, okay? The endothelial function is also very important for regulation, okay? Not only vasomotor control, the action of the vascular, but it controls the inflammation, insulin resistance, so forth and so on. So we have a new approach in diabetes, and we have some different technologies that enable us to provide all the markers that we have. So I'm going to actually move into the software, and then maybe toggle back to the technologies. So basically, PreCheck is it's an integrated platform that links those different technologies that I pointed out and synthesizes the technology into software. Okay, so the hardware performs all of the tests. The data is fed to the software, okay, to the computer, and the computer then provides markers. And so this is the main screen, okay? And on the main screen, there's a manual. And this manual covers all of the topics related to the device. Okay, so the different component pieces, how to perform a test, how to set up the system, what are the contraindications? There are a few contraindications. The main contraindication has to do with any type of pacemaker or implantable device. If the patient has that, then they're not a candidate to perform the test. The software will guide the technician. It's very intuitive, and before the technician can even go through the various screens to perform the test, the software will ask the technician if there are any contraindications. So very easy to use software. I'm not sure if you've used it yet, if you've used the system yet. I presume a few of you probably have, so you know what I'm talking about. But
yeah, we have.
Okay, so then you know what I'm talking about. Anyway, so the manual's embedded. It covers everything related to the system. So I'm doing a brief overview of what the product is. And you know, if you want to learn more, you can certainly read through the manual. It's a 57-page manual. Okay, so now I go ahead and I log in. Okay, and brings us to this screen here. I'm not going to do a full demo because I don't have the system set up, but I want to show you a few features of the system so that you better understand what we're doing. So, of course, this is where you're going to add a patient and begin the testing. And once you've done that, and once you've gone through a test, that test is going to populate here in the database. And as you can see, I have a pretty large database of patients. In fact, I'm going to click on one patient now. So we can start looking at some of the markers and then come back to the software. Okay, so what we have here is the main screen. This populates at the end of the test result. And what's important really is the overall score for cardiometabolic risk for diabetes and cardiovascular disease. And of course, what we have is risk markers. So it goes from low risk to severe risk, and it's a color code. So the office, the practice definitely needs to have a color printer to provide accurate guidance. And then we have the Autonomic score, okay, which represents 40% of this overall score. We have the vascular score, which represents another 40%, and then we have the lifestyle. Over here, we have the charts, okay, that relate to autonomic risk. So we have the chart for small fiber neuropathy, the microcirculation risk, as well as cardiac neuropathy. We have the vascular charts, the artery risk, systolic blood pressure, central systolic blood pressure, as well as PAD, and then the lifestyle, the body composition, and the fitness chart. If I click on the autonomic, okay, it actually breaks down all of the different areas that we're testing for autonomic function. So it breaks down pseudomotor, okay, the pseudomotor is a sweat motor. It includes the sweat glands, the nerves, as well as the circulation that activate sweat activity. And this test we perform to provide a marker for small fiber neuropathy. Okay, so it's using the electrodes via galvanic skin response to provide the small fiber neuropathy risk. Okay, and you see individually what this is correlated to, and of course the range from a normal to defined small fiber neuropathy. Heart rate variability is basically the analysis of the heart rate and measured in milliseconds. So there's changes in the heart rate, and there should be variance. It's reflective of autonomic nervous system activity. And so this test is performed, the HRV is performed to give us a measure of autonomic function baseline. And then as you perform the test, you know that there's a Valsalva, there's a breathing exercise, okay, as well as a postural change. And we do that to evaluate parasympathetic as well as sympathetic nervous system activity to provide us with markers of cardiac autonomic neuropathy. Here we have the comments. So not only do we have the tests, which are color-coded, we have the charts, but we have the commentary to provide the doctor with some guidance on what to do with the results. Before I continue on to vascular, let me just point one thing out. This little I here is for information. Okay, I don't know if you've printed this out. If you haven't, you probably want to, because it shows, it's basically a glossary for all of the different markers that we have, okay? And explains in detail what these markers are, as well as the evidence that supports the markers. So if you haven't printed this out, I highly encourage you to do it, read through it so you have a better understanding of the parameters and all the particular submarkers. Okay. Now, we're evaluating the autonomic score, or the autonomic nervous system. Okay, we're trying to identify for neuropathy, which is a complication of diabetes. But we're also trying to find out what's going on with the arteries. And so we have the vascular function marker. So we're evaluating the small arteries. Okay, and you can see what these individual markers that we have based off of the pulse oximeter. Okay, this is a spectral analysis that we're able to get from the pulse oximeter, what it's related to, and the risk for small artery disease. The upper large artery is basically the pulse pressure. Okay, so this is the analysis using the pressure cuffs, and it provides us with markers for blood pressure, or central systolic blood pressure. And then the lower large artery has to do with the ABI measure. So it's, again, blood pressure, and it performs the left ABI and the right ABI to evaluate for PAD. Okay, and then we have the comments that provide some guidance. So pretty self-explanatory. Again, this I will help you. If you've got questions, you need to print that out and read through that. And then finally, the lifestyle. So not only are we testing the autonomic nervous system, okay, so we're testing for small fiber neuropathy, we're testing for cardiac neuropathy, we're also testing for vascular, okay? But we know that since we're looking at metabolic, cardiovascular disease and diabetes, these really are lifestyle diseases, generally speaking. And so an individual's lifestyle certainly affects their vascular function and affects their autonomic function, okay, which of course can lead to disease. And so we evaluate lifestyle, and that has to do with their diet, okay, and we're looking at their fat mass, and we're able to get that from the bioimpedance, from the electrodes on the foot. So we need to know, okay, well, what's going on with their body composition? What's their BMI level? And so we have that. So we have the BMI, we have the fat mass, we have overall body composition, and we have diet. So we have the fitness markers, whether the patient actually does any exercise or is just sedentary, and we're able to get that from the analysis, the heart rate variability analysis as well. And so we have some commentary too. So what you'll find is that doctors, once they understand the system and how it's integrated and how your lifestyle influences your arteries or your vascular function, your blood pressure, also how it influences your autonomic system, okay, then this becomes a very, very compelling medical device for the doctor to have. So with this, what we've done, since I'm on lifestyle now, is we've included a wellness program. But down here, you see a few different items that we can click on. And what we've done is we've created a wellness program. So if the patient's BMI is over 30, it indicates that they're obese. And I'm not going to get into the CPT codes with any type of detail, but the BMI, if it's over 30, it indicates that the person's obese. Doctor can perform a wellness consultation. And what we've done is we've put together a wellness program that includes the risk for cardiovascular disease and diabetes, the different markers that we have, and then we have the recommended diet, okay, the recommended exercise, as well as some suggested supplements. So we've included a wellness report. This incidentally needs to be printed out separately. So you'll print this out. It's a PDF. You'll just print that out separately. We also have the trends. So the doctor that performs the test can see how well his treatment plan is working, his intervention's working. We have an overview, just a quick shot into what's occurring, and this is an overview report that can be used as a comparison. So you can input a visit from a different date, and you can do a comparison. Okay, so this is a quick snapshot. The trends for the charts, okay, and the different graphics that we provide. So you can see that we have a pretty comprehensive device that includes a lot of different markers to help the doctor determine, A, if their patients are going into cardiovascular disease or diabetes, okay, with high accuracy based off of the tests, to determine if their patients are going into complications related to metabolic disorders, whether they have neuropathy, okay, whether they have vascular disease or problems with blood pressure. And then, of course, objectively can evaluate the patient's lifestyle, okay? Not subjectively the patient telling the doctor, yeah, I exercise, yes, I do this. No, we actually can objectively measure their fat mass, their body mass, as well as their fitness. And so that's pretty significant when you think of everything integrated into one system. Now this result, as you've seen the system, as you use the system, you know that you'll go and you'll go here to print this particular result. You'll see the icon here, print. It'll populate in PDF. Okay, so it populates in PDF format, and similar to the dashboard, this provides the scores for autonomic function, vascular, the lifestyle, the trends, with some notes, so the physician can input some notes, or the technician can input some notes, the graphs, and you should also, and I'm probably not defaulted to it, you can also select the overall score. So if you want to change the reports, you can. You go into settings. Okay, so I'm going to go ahead and I'm going to select all. And I recommend the physician, select all. You save and exit. And let's go ahead and view. So from this dashboard database, you can also manage the report. So we can view the physician report here. Okay, so this should provide all of the reports. So it does. It provides autonomic, vascular, the lifestyle, and the overall score with some commentary. Okay. And you can see what the commentary is, and it's going to vary depending on the severity of the results. So, for example, here you see lifestyle. Diet marker evaluation, obese type 1. We suggest following a weight loss program. A wellness program with low carbohydrates may help. The fitness is poor. This is a quick snapshot into what's going on with the patients and quick commentary from the clinician. Graphs, charts. Okay, so that that should just about do it. Now, of course, in settings, this is if you have a system, all of your blood pressure cuffs, all of your Bluetooth devices should be connected. But if they aren't, you would do it through settings, and you would walk through the section here on doing that. And of course, if you have questions, there's two things you can do. One is you can reference back to the manual, okay, which covers everything, okay, and how to set up the system and the software and the cuffs, okay, and how to calibrate, or tech support, okay, and there's a tech support team that can assist. So with that, I think I pretty much covered what I needed to cover without bogging you down in too many details. I can continue. This is a 50-page presentation, but I'm not going to go through the full thing because I have a feeling that if I do that, it's going to bog you down. I think I've given you what you need, the basics, to understand what the system is and what it's doing.